This is a really interesting segment, as most of what you've heard for today, that Harborview has a distinct personal attachment to us as practitioners, but this next section we'll learn a little bit about some of the patient's personal attachment. So Dick Foley. Dick is known throughout the Pacific Northwest as a musical performer and a television host and a master of ceremonies. For 16 years, he's one of Seattle's most respected and recognized television professionals, and we've seen on the trauma story from Harborview that he was part of. He began his professional career as a lead singer for the internationally known folk singing group The Brothers Four. I'm sure everyone can pick up their CD on the way out. T-shirts are available at Pioneer Square. Dick spent 16 years in the broadcast industry as an on-air host of several programs of COMO, Seattle's ABC affiliate, and during his broadcast career he's awarded 2 local Emmys. Today he applies his skills in the healthcare center, producing clinical and educational videos at Virginia Mason Medical Center. Dick served for 6 years as a trustee for the Leukemia and Lymphoma Society and has volunteered for many years in support of the Seattle Coral Company. Dick also served as spokesperson for the Whole Food Nutrition product line distributed by NSA. Dick and his wife Mary have 4 children, 2 grandchildren, and they make their home in Bellevue. So it is a real honor and a personal privilege to have Dick back to the podium. And this next section is regarding real-life Harborview story. Thank you, Dick.
Thank you, Doctor. Thank you very much. Thank you. We have been hearing a good deal about the 1970s today, and I learned a real hard lesson in the 70s, but it led to my deeper understanding of that bond that can form between a physician and a patient. There was an internal medicine physician at Swedish who persistently chased some symptoms for me until he was able to diagnose cancer of the colon. I was 33 at the time. But I benefited from the marvelous skilled hand of Bill Hutchinson, who performed my surgery. But the internist who worked with me and helped me reach this diagnosis became a lifelong friend. And I think that's what happens in so many cases in your profession as well, your specialty, that you change lives of patients in such a way that there is that bond that will never be broken. It's fun to explore that from a television production standpoint, and of course it's that bond along with what we in television call the medical miracle that I think attracts a larger audience to really see a little bit behind the curtain, if you will, as to what you do and how lives are impacted by what you do. So today we have a marvelous opportunity for Dr. Hansen and a patient of his to have been reunited sometime after some pretty remarkable work that was done here at Harborview. So you'll meet, she was then Marty East. You'll meet her and hear her story, her encounter with Dr. Hansen, and all about a really happy ending. Have a look. More than 40 years ago, on a rainy winter night, a group of Edmonds High School cheerleaders were returning from a basketball game when tragedy struck.
People started screaming, so I looked out the window, and then there was a car with big headlights coming right at me. And then it smashed into me.
The accident was a front-page story, but behind the news was another story. The story of a young chief resident, Dr. Ted Hansen, who risked his career to save Marty East's life. Her survival and Dr. Hansen's tenacity would change the face of orthopedic surgery and both their lives.
And it was such a big test that it really, if you're going to try to prove something, she was the one to try to prove it on.
If he hadn't saved my life, I wouldn't have my 4 children. So there. That's the result of what he did for me, getting me up and around, and he allowed me to come back and fight my fight.
When that fight began, Marty was a junior in high school and one of 9 children.
16 years old, and you think you'll live forever. It was December 6, 1968. And we were coming from Everett towards Edmonds on Highway 99. This was the beginning of basketball season, and we were returning from a jamboree. And we were coming home on a rainy night, and we weren't paying attention. And we crossed the white line into the incoming lane.
The car carrying the 5 cheerleaders smashed into another car. All the girls survived, but Marty took the brunt of the crash.
My leg broke, but I thought, this is okay. I can still sit. I can handle this. Then the car went berserk, and my head smashed against the roof of the car, and my skull cracked 12 to 14 inches, and I slumped to the seat, and everything went black, and I thought I couldn't make it.
4 decades later, Dr. Hansen can still recall Marty's condition when she arrived at the University of Washington Hospital.
She'd had a head injury and a femur fracture, so her leg was quite distorted, and her head was obviously very badly injured. And she had kind of swallowed her tongue, and so she had stopped breathing, and they weren't sure she was alive.
In a deep coma, Marty hovered between life and death. Because of her fractured femur, doctors put her in traction, which required her head to be tilted down. Meanwhile, her brain was swelling and her lungs filled with fluid.
She was going downhill.
With Marty rapidly declining, Dr. Hansen recognized that skeletal traction was complicating her condition.
You know, I just used my old farm boy logic, is that if you had too much pressure in your head shouldn't be hanging down. And if your lungs were full of fluid and so forth, you shouldn't have your lungs low down. You should be sitting up.
Dr. Hansen approached Marty's attending physician with an alternative, intramedullary nailing, a surgical technique developed and used in Germany since the 40s, but new to the U.S. Hansen had only performed it a handful of times. His superior, a staunch proponent of traction, did not share Hansen's enthusiasm.
I said, you know, I think if we were to nail her femur and we could sit her up, that all these things would be markedly improved. And he thought that was an awful idea. He said, if you do that, don't tell me about it, and stomped off. But that wasn't, don't do that. So I accepted that as okay.
Dr. Hansen proceeded with the intramedullary nailing, making a small incision through the hip. Then he reamed out the inside of Marty's femur and inserted a metal rod or nail to stabilize it. As the moments of Marty's life ticked away, clearly, this was her last hope.
Since people thought that she wasn't going to live, well, we had very little to lose. I was very confident that if we were allowed to do it, that it would give her a chance.
It didn't take long to know the chance was worth taking.
And as soon as that bone was stabilized, then immediately the swelling starts to go away, but the main thing is, then we could sit her up. And we didn't have to have her lying head down in traction, and that's what made the huge difference.
Though Marty remained in a coma, her parents were profoundly relieved their daughter would live.
They saved her life. That was a miracle. I held her hand and I said, if you can hear me at all, squeeze my hand. So pretty soon I felt this squeeze. So that was the first time I had had any response for her after at least a month or so. So that was wonderful.
It's just a miracle child, you know. She's my best friend, too.
And more miracles followed.
I was a cheerleader again. The next year, I had the great fortune of being elected homecoming queen. I graduated right on time, 1970.
Today, the Marty East case is still considered a milestone in the history of orthopedic surgery.
We began to call that the Harborview philosophy of orthopedics was due to the Marty East effect.
Over time, intramedullary nailing has proved the benefits of early mobilization and provided better outcomes for patients.
It confirmed everything that I believed that would happen if we did it, and so then I was really convinced that it was the way to go. I wasn't able to start doing it uniformly till about 4 years later, when I became almost 5 years later, when I became the chief of orthopedics here, and I could do whatever I wanted.
And even though Dr. Ted Hansen has seen thousands of patients through the years, one is never far from his mind.
You know, I've thought about her frequently my whole life.
Oh, I love Dr. Hansen. I've always just thought he was the most amazing person. He saved my life.
On this day, we followed Dr. Hansen on a house call.
So,
It's been over 40 years since he's seen Marty's parents.
So nice to see you.
I've been thinking about you guys off and on for what now, 30-some 40 years? 42 years, right?
42, come right in.
I remember how kind he was. And to have someone take that time and care is just such a remarkable thing.
For Dr. Ted Hansen, Marty East's case was not only a defining moment in his life, but also a cornerstone in his career.
You just don't want to let other people's discourage you if you're sure you're right.
And for Marty and her family, that made all the difference in the world.
I have a very nice life. I have a wonderful husband and 4 great children.
We're eternally grateful for saving her life. And whatever his mission in life, as far as we're concerned, he's fulfilled it many times over. Thank you, Dr. Hansen.
Thank you, Dr. Hansen.
Well, I must have had a little bit too rich of a life. Everything that comes up makes me think of a dozen other stories and a dozen other things that I would like to tell you, and we can't possibly do that. So I've combined my 2 talks, and I'm going to try to stay in the right amount of minutes and just tell you a couple things that I think haven't come up as much. And then I couldn't make, no surprise to anybody that knows me, I couldn't make my computer work very well the other day. I wanted to put a talk on. So I just tagged the talk on the back of a little thing that I'd put in a PowerPoint thing, but it does very nicely explain my feelings about management. And you probably read that by now. And he says, Sid will check with me, I'll get the answer back to Sid, and then Sid will get back to you, and within a week or 2, any questions? And that's the way kind of things go. It's always interesting to me when people have a life where they can send it to committee or think about it a while or put it off for a couple months, because all of us as traumatologists know that our job cannot be put off. When it's there, you must do it and finish in a certain amount of time. And when somebody tells me that, well, I know you need that stuff very badly in your clinic, but we're working on it, we're going to have a clinic, we're going to have a committee, and then we're going to do this and that and the other thing, I think, Jesus Christ. So, and a couple other comments in regard to patient care. I saw this nice comment in one of our journals recently from Terry Canale. Patients don't care how much you know until they know how much you care. And that's certainly something I can agree with. And this is another one Mark may not like, but in regard to scientific studies, not everything that counts can be counted, and not everything that can be counted counts. So you got to be careful what you read into what you read. Now, when I think about telling you a little bit about Harborview traumatology, the person I think of first always, the older ones here will recognize Merrill. Merrill Sandberg, she was called Anderson or something at the time, but she's really Merrill Sandberg, and her brother was Ryan Sandberg, who played for the Cubs. And they come from Spokane, and she was one of the most remarkable people, because when I started working here and became the chief and pretty young, and there were a lot of things going on, and I didn't have time to do this other stuff, the management and run the department and so forth, because with Bob and I sharing the whole load of, well, first I was alone for a while, and then when Bob and I, we had plenty to do without dealing with all the administration and everything, and Merrill took over everything and did a fantastic job, and she was amazingly helpful at getting this department started. She was the department in the office by herself, again, too, for several years, and I just want to let you all know that there's lots of, you all know already, but there are lots of very important people. I see Steve Scheimer smiling. He liked Merrill too, didn't you, Steve? Steve, I should have mentioned also, was the way we got started in AO. When I started here, I had learned a little bit about AO equipment from a fellow that returned from Germany, where he saw it there wasn't any around in the United States much, and it was being sold by Smith, Kline and French. And I wanted the new set of this equipment, and the administration, again, said, no, you can't change equipment, because we just changed the chief's apartment a little while ago, and every time a chief comes along, we can't be changing equipment. So I got to know Steve, who had worked for Roger Anderson here in Seattle, and I knew Roger Anderson well, and he used to sell tower tables, which none of you probably know anymore, but it was very important things to know about if you weren't operating on fractures, if you're trying to put them in a spica cast or traction. Anyway, he negotiated with me through, I think that was right, isn't it, with Smith, Kline and French, that I made a deal that if we would purchase the something like $10,000 worth, which would maybe give you a couple nails now, but you could get a lot of stuff for $10,000, and if we would purchase that, they would give me all of the AO equipment that comes in little red boxes, you know. You've seen pictures of it all over there were two then, 2 boxes, had everything we needed, and it was great. So that's how we got started in that, and I can't get off on that. Like I say, I keep getting diverted off to other things. But what's important, a philosophy or an understanding of how the systems of the body interact, which you've just been hearing from Larry in a much more scientific way than you'll get from me. Sometimes I don't know why I know things, but it seems like it works when I figure it out, and so I'm always glad to hear why. And that's why John Border was a great friend of mine. He could tell me why things that I thought were maybe right. Pertinent to fracture care, I had learned from switching from engineering into biology at Whiteman, I learned a little bit about evolution. And I learned that the function of the skeleton is to protect the soft tissues. The more injured the soft tissue, the more necessary to repair the skeleton. And now you're going to see one of the slides that I used to make. When I started making slides, we didn't have all the things that you have now. I used to have to take a picture from a magazine and then put little block letters that I got at the stationery stores on it and take a picture of it. First though, this one it shows my idea of skeletons. On the upper right, you see a bivalve skeleton. On the bottom, you see a circular skeleton. And on the left, which was Sarmiento's favorite, a hinge skeleton. And we've been through all that in orthopedics. In fixing things, we used casts and we used hinge casts and we did various things. But the modern tech thing for people is to have the skeleton on the inside. But it still is what it does, is protects our skeleton, which is, Larry's already talked a little bit about it. But here's one of my old slides that I used to try to convince people to think about soft tissues. And as near as I can tell, it worked very well. Now, moreover, stabilizing fractures is beneficial to function of vital organs, particularly lungs, brain, and gut, which is what Border taught me and taught me what was going on in all these places, accomplished by decreasing pain and pain medication. And I've subsequently decided that pain medication is really our enemy. Morphine makes people sick. It makes them, it stops all your normal body functions, does all sorts of bad things. And you all know that if you fix a fracture, the pain from the fracture is soon gone, or mostly gone. You don't have to be on morphine and be lying in bed and so forth. So again, to my sort of farm boy logic, it seemed very logical. You just repair the skeleton and the soft tissues will get better, and that didn't seem to be a big mystery. Now the example, as you've already seen, was Marty East. And I'm going to go, I knew you've heard all this story, I'm going to go over there quickly. I didn't know all this was going to come up when I put this together, but she came in '68, all these things you know, severe head injury and fracture of femur. This is her skull fracture again. She said maybe 14 inches. Well, if you go all the way around your skull, it may be nearly that. And the top of her head was sort of lifted off, and her femur looked like that, bad pictures. We didn't get very good pictures in 1968, often. Initial skull decompression followed by some time in that traction device that they had a nice picture of somebody like that, but they're always head down. She had, after a while, a tracheotomy with draining pus, and she was comatose, but also doing a little thrashing. It looked like the proximal femur was going to come out through the front of her thigh. So, as a chief resident who just recently learned to do closed femoral nailing, I had what turned out to be a relatively heated discussion with my attending. And finally, he stomped off, and he said, if you do that, don't tell me about it. And some of you heard this story, but that seemed easy enough. I didn't have to talk to him. I didn't like talking to him. So we went to the operating room the next day, and this is what happened, although I didn't have an immediate post-op x-ray, but you've seen this also. But she wound up healing up. It took her a little while to come out of her coma, but she was immediately better. As soon as we got her head up and her chest up, then, you know, she started brightening up, and she started getting rid of her pneumonia, and you obviously all know what happened to her eventually. But we called that then the Marty East Principle, and it took me a full 4 years or so out of residency and fellowship before they let me take over at Harborview and do what I wanted to do, as I said. But we remembered the Marty East Principle. That was a good way to do things. And I'm going to show you just a few other things and also tell you a little history. You realize when I trained, prophylactic antibiotics were not used. They were thought to be malpractice. And the people that trained me were panicked about infection. If I did a lot of scrubbing, interestingly enough, who was it that talked about, they talked about the, having bowel cancer removed by Bill Hutchinson. I actually worked with him, but in those days for Swedish as a resident and as a student even. He was a taskmaster. But those guys, if you went and scrubbed with them and you made the mistake of letting your hand drop below your elbow, it was back to 5 minutes more scrubbing. They were absolutely panicked about infection because they grew up treating osteomyelitis and polio and tuberculosis and all these infectious things that they had no good answer to. And they were not about to let you break any technique and maybe get something infected. And so doing an operation that they considered maybe not terribly necessary, or doing this surgery, open surgery when they thought it should be done closed, was very worrisome to them, which is why we got all this trouble. But when I went to get away from this same attending the year before, I went to Spokane at the Shrine Hospital and had lots of time, and I read a lot of stuff from Burke at Harvard. It was about, he was doing experimental stuff with preoperative antibiotics and showing that if you started cidal drugs before the, you guys know all this stuff, but I want to tell you it wasn't known in 1968. But you started cidal drugs before the thing, then they could be helpful. So I came back and wanted to do this nail series with doing it that way. And so we wouldn't get in trouble. And the whole faculty got so upset with me that I put this paper, I did a beautiful paper, and I put it in my drawer because they hated it. But Dr. Clawson was a little bit more forward-thinking than the rest, and he said, when the others weren't on the earshot, he said, just go ahead and do that. That'll be okay. And so we did, but that's what allowed us to make the change. And I had a slide in here one time that showed the big secret that I have was timing. A lot of you guys in the room could have done the very same things I did, but you didn't come along at the right time. And that's probably because your parents hadn't gone through the depression, the real depression years ago, and were afraid to have kids. And because in my generation, getting into medical school, there weren't very many applicants. There weren't a lot of people looking for jobs like that because it was very tough times in the time when I was born. I'm not sure where I was going with that, but the timing, there wasn't a lot of competition for doing some of these things, and it just happened. These other things came together, better anesthesia, and then, as I said, the AO equipment was coming out, and there was better stuff coming from Germany through the OEC company. Brought all of Kuncher's stuff over, and then we could get going. Now you've seen this too, but this is one of the first applications of the Marty East Principle at Harborview. This lady had been found 8 hours out after an accident where her car hit a tree. And she had open femurs, open knees, bad head, not such a bad head injury, but a head injury and neck injury actually. And something up in her arm that it wasn't bad, but she was in shock and arrived in the emergency room. And sure. Is Bob still around? You remember some of the names of the residents that were, there was one of the residents who was just starting. Of course, they weren't used to this stuff yet, and he called me and told me he had this patient, and I said, well, get out the blade plates, which we'd used a few of by that time, and other things, and we'll operate on her. And he said, she's 8 hours out, and she's in shock, and these wounds have been open for 8 hours. And I said, well, I know that's not ideal, but she's got a lot of problems, and she needs to have her skeleton repaired. And he was pretty upset with this idea, but we came in and this is, again, later pictures, but we fixed the intra-articular fracture and the patellar fracture and the supracondylar and the shaft fracture, everything in one stage. Very soon, we got probably about 12 hours after injury. And we kept her in the hospital for a while, and then we sent her home, and we figured, well, now we'll get her back at about 7 or 8 weeks, and we'll start some rehabilitation on her. We'll just let these things heal. We'll keep her in bed most of the time. Well, she had started feeling good and started rehabilitating herself, and so when she came back, this is where she was on that side, and this is where she was on the other side, and the appearance, and we kept her a couple days and said, you're on your own. You're doing fine. And the next time we saw her, a year or so later, we figured we'd take out the hardware and revise her scars a little bit. You'll notice that she didn't get emaciated by all this trouble, and she wound up doing quite well. Another one, just to show a little bit about my second topic, which is going to be blended into this one. This was more about infection, but this guy came in the mid-70s as well. He'd been out celebrating graduating from an underwater welding school, which my dad had something to do with over in Pasco. He loved to teach people to do things. Teaching you to be a lawyer was not interested in him, or something intellectual, but if he could teach you to do some actually productive work, he thought that was great. So he was at this junior college, and they were teaching people to weld underwater in Pasco. Now, Pasco seems like a desert to most people, but there's a port there, interestingly enough, on the Columbia River. But anyway, this was one of the things he had, and he had a femur fracture, and so we did what you see here. We fixed the tibia, and then we rolled him over and fixed his femur on the other side, and we fixed both of his ankles. And then we kept him in the hospital for a while, took him back and did a skin graft. And then his mother arrived from Connecticut and said, gee, I'd like to take him home because I work for an orthopedist and he can follow him. And I said, oh yeah, who do you work for? And she told me the name of an Army colonel who had just written a big diatribe about the people that had taken care of people that went down in that plane in Florida, and talked about how you should never close wounds, you should never put metal in wounds, and he was a very famous guy. Do any of you remember his name? Is it Colonel something or other? So I said, well, you know, maybe I better take that hardware out before you go home. Your doctor is not going to like this. And anyway, she said, well, he's a good guy. So they took him home, and I didn't hear much from him, but the next year I was giving a course at the academy, as we did often, on open fractures, and I noticed that he was sitting in the front row. And so after the course, he came up and talked to me, and he said, you know, that patient you sent, that was the best result from those injuries that I could ever imagine. So today I just came to make sure that you were warning people never to close the wounds after you put the metal in. He'd bent a little bit. It was okay to fix it as long as you didn't close the wound. And of course we didn't, because the local people here in town, John Stewart and some others, were also warning me that. One more, just to show you about infection and the stabilization of the bone. Self-inflicted gunshot wound, sat on a shotgun or something. Maybe I'll give you two more real quickly. This is, you can read the little blurbs that go with this. He delayed a little while. He'd lost his nerve function, some vascular function, some repairs were done. Then he was put in 90-90 traction, and the soft tissues kind of resolved, but he stayed non-united. You can see he was draining in his groin. You can see the sinogram there. And so in my usual simplistic thought process, I thought what he needs is a nail in his femur. So we nailed his femur, and he healed up. And but not his sinus, but that's not a big problem. Infection is overrated, I think, now that we have antibiotics and know what it's all about. And so we then took the nail out and debrided a little bit, and then he healed up, and the last we knew, he was a most valuable player in his slow-pitch softball league. And this is his picture at that time. Everything's cleaned up, his muscles are back, his motion is back, and he's doing fine. And the one further one, a similar thing, a young man, 18 years old, in Montana, went off a motorbike with nobody around and sat there with an open fracture of his femur for 18 hours or something like that. This is how we went in the hospital with this wound, and they didn't know what to do with it then. They kept him in traction, put him in dressings. What the hell I thought that was going to happen from that, I don't know. But anyway, he was in traction with dressings frequently, but they had to give him anesthetic to put the dressings changes. He lost about 50, 60 pounds in 2 or 3 weeks, and they were going to disarticulate him at the hip. And then somebody said, oh, you know, we could send him down to those guys at Harborview, let them worry about it. So I was hoping John would, or Dr. Winquist would be here, because we had a resident at that time named Byron McCord, and he was really conservative. And he talked to me about this patient, and I said, yeah, we'll nail his femur. And all the blood drained out of his face, and because you could see this, the yellowish femur sticking out there, and he thought, boy, I don't want to be associated with this. Not only did I make him associated with this, I said, I'll hold the bone, and you go up above and make the incision and put the nail in. And he was just petrified. He obviously did not want to be there. But I convinced him to do it, and I have a way of convincing people to do things. For instance, I don't know why the anesthesiologist put Marty East to sleep, but they didn't argue about that. They just put her to sleep, and as with everybody else. Anyway, we nailed the femur, and you can see the wound get better. And then he comes back. This is while he's still in the hospital. Then we were able to operate on a little dislocation in his arm, too, which they'd avoided doing because of the infection in his leg. And we sent him home, and the same thing. Many months later, they called me and said he'd come in the hospital, and he was having a little drainage from the side of his leg, and was I worried about that? And I said, why, what was he doing? Well, he was up hunting elk. Well, and I don't think I'm very worried about him. And we said, we'll send him down in a few months, and we'll debride that and get it cleaned up, which is what we did. He came down, and we took out the nail and debrided the sinus, and he's healed up, and he's probably 50 years old now, and alive and well as far as we know. The philosophy holds, the Martinis Principle works, and is being constantly used and perfected by the current generation of trauma surgeons, which are you guys. Thank you very much.
Few individuals have touched our lives so completely as Sigvard Theodore Hansen, Jr., MD. I was told this was a eulogy. My whole speech is based on a eulogy. Hello, Dr. Hansen. Holy crap, what do we do now? All right. Sigvard Theodore Hansen, Jr., MD, taught us many things, one of which is that when they ask you to give a talk on something you're not prepared for, just go ahead and change the subject. And so today, I would like to talk about the impact Sigvard Theodore Hansen, Jr., MD, has had on all of us in this room and indeed worldwide. I am pleased so many of us were able to make it here today. I would like to thank Jens, Bruce, Cliff, and Sam for asking me to stand here to honor our mentor. I am sure when they asked me to help them, they thought I might feel uncomfortable cajoling, twisting, or even breaking arms in the effort to gather everyone here today. They were wrong. For when it comes to Sigvard Theodore Hansen, Jr., MD, there is nothing I would not do. I would be remiss if I didn't start by thanking Dalla for all she has done for us over so many years. On one of my trips to Seattle, Dalla insisted I call her upon landing. How was the flight? I'll send Ted out to pick you up. I was horrified. I took the super shuttle. When I got to the house, you set me up downstairs in the bedroom. The drain in the new slate shower was clogged. And at your command, there was the master on his hands and knees with a snake cleaning out the drain. I was mortified. Then, on another trip to Seattle, my whole family was not off the plane for 5 minutes when Betsy's phone rang. It was Dalla inviting us over for dinner. Within a few minutes, the kids were out on the terraces digging up potatoes and picking fruits. So, Dalla, you've always been so welcoming to all of us, and we appreciate you. I would like to thank Janet for her help preparing my telling of the story of defining greatness. Why do I keep calling him Sigvard Theodore Hansen, Jr., MD? It has always been amazing to me that one man can have so many names: Sig, Siggy, and Ted. The family seemed to call him Ted. In fact, one of the most hotly debated issues amongst the brotherhood has been, what do you call him and when do you call him that? Yet, in all the years I have known him, I have never called him anything but Dr. Hansen, sir. He never invited me to call him Ted, and so I have not. The wives and kids seem to find it easy to do so. Ted, Ted. Seemingly not enough of a name for such a man as this. And so we have created secret names for you. Names we only utter in the secret privacy of our Spinoza meetings. But the name that stuck came from a young lad. My son Alec came down the stairs one day and called Dalla Dr. Hansen, and then asked where that white man was. And so ever since then, we have referred to him as TWM, the white man. So let others call you Sig, Siggy, and Ted. For many of us, you are Dr. Hansen, sir, or really, the white man. We ACEs have had some wonderful lifelong friends, mentors, and colleagues. My time at Harborview, and indeed throughout my career, has been made special by the white man and by what he has built at this special place. I have learned so much and am thankful for Bruce, Steve, and the people in this room. Note that outside of Seattle, Bruce smiles and Steve drinks. Mark Swinkowski, you were another of the many people who passed through here. That made it special. We have enjoyed your leadership here and in our national organizations, like the ABOS. I passed my MOC so we can still be friends for another 12 years. We have a few special AO guests here with us, Jim Hughes, Jim Kellum, and Paul Manson. Thanks for coming to be with us today. Paul is one of the funniest guys around, and I'm not ashamed to admit it. I have started referring to my wife the way he does his. And so, Mrs. Sands couldn't be here today, but she sends her love to Dr. Hansen and wishes him all the best on this festive occasion. I will not bore you all with the recitation of the accomplishments of Sigvard Theodore Hansen, Jr., MD. We have all been to many of these things over the years, and quite frankly, we're getting a little tired of them. He has had many honors, probably in anticipation of the many times he said he would soon be retired. Boy, you sure fooled them all. The ACEs were always thankful for the wall, which made it impossible for him to retire early. And I'd like to point out each of the ACEs has a section they are most closely associated with, and the section John and I built is still there, standing strong. Obviously, John designed it. On the aerial map, you can see the wall below, the terracing above, and the giant lawn of the neighbor's house. What the neighbor doesn't know is that Hansen's wine cellar has extended across the property line under his lawn. Instead, I would like to share with everyone the things we ACEs most remember and use every day in our lives and practices. Oh yes, I said lives and practices. For you see, we have learned many life lessons from Sigvard Theodore Hansen, Jr., MD. If you sit next to him, you will learn a lot about everything just by listening. But perhaps since he isn't one of those people who speaks just because he enjoys the sound of his own voice, the knowledge is sometimes thought to flow down gradient via osmosis. I have used many of his stories and methods in raising my own children. His father used to have him help fix things on the farm. Mysteriously, every tool they needed was back up the hill in the barn. And the way he told it, it was uphill against the wind each way. I am sure that this was Sigvard Sr.'s idea of working out, doing sets, and doing wind sprints. Somehow I doubt there were many gyms around. When he was a resident, the Whiteman was quite a character. There is a famous story about one of his attendings who was a shoulder expert and taught people closed manipulation for frozen shoulder. As Dr. Clawson was careful to describe holding the humerus very proximally to prevent fracture, the Whiteman snapped a pile of tongue depressors behind his back. The blood drained from Dr. Clawson's face. Dr. Hansen was placed on double secret probation and shipped off to Spokane for a few months. The Whiteman's fellowship was in pediatrics in England. It was here he had the vision, which we call the giving of the understanding of the foot. The voice said, Sigvard Theodore Hansen, Jr., MD. Apparently the voice in the bush was also afraid to call him Ted. Take thyself home to Seattle, and being very naughty in the eyes of the AOFAS, keep thyself isolated so that you may figure out the truth of things. While finding new ways to do trauma, his first love was always further south. And so the story goes, as he got more faculty up and running and made them experts in their area, he moved further south until he got to the area below the knee. What has he contributed to orthopedics? Come with me for a tour of the fracture ward some years ago. A motorcyclist has a femur fracture. He was placed, as was the standard of care at the time, in traction. The Whiteman offers him a new treatment involving placing a metal rod in his leg. No way, the guy says. What is this, some sort of experimental torture device? And so the cyclist stayed in traction as one after another accident victim was admitted, rodded, and discharged. Finally, on rounds one morning, the patient asked if he too might get a rod. But many of us here would argue that his major contribution to orthopedics was not the IM rod technique or the sliding hip screw, but rather it was bringing the principles of rigid internal fixation to the foot and ankle. Before there were K-wires and sutures, then came the COPO Defoe, the bolt of lightning that yet again changed the world of orthopedics. Suddenly, even the surgeons in the rest of the country began to use rigid internal fixation for foot reconstruction. Now there isn't a single foot surgeon who does not use plates and screws. And it is all thanks to the Whiteman and the people in this room. Who many considered to have metastasized outward from Seattle and brought the truth with them, sometimes enduring local resistance. I chose a Navy scholarship because I figured they would put me on a ship, and I love seaside condos and sailboats. Little did I know they would shave my head and send me out with the Marines. But as a result, I met Fred Lippert. I have to thank Fred Lippert for interesting me in foot surgery, Seattle, and the Whiteman. When I deployed with the 7th Marine Expeditionary Brigade, Fred was pulled out of Seattle and placed in my seat in 29 Palms. When I returned home to 29 Palms, Fred suggested I do foot and that I go to Seattle to do it with some guy named Hansen. What a perfect match it has been, and thank you to Fred Lippert. Now, Bruce tells the story of when the Whiteman was department head. He was asked to be medical school dean. He is reported to have said, I consider my 5 years as chairman of orthopedics to be a prelude to hell. I would consider being the dean as actually being there. Yet here before you is proof that Hansen indeed aspired to further administrative duties. Doesn't he look happy in his welcome aboard picture as acting medical director? The Whiteman opened up the doors to international experience for many of us. He got us involved in the AO. The Whiteman says that one of our main jobs is to promote our junior faculty, and like everything else, he walks the walk. The picture on the right is the Whiteman with Hardy Weber shortly before Hardy passed away. Truly, as they say in every AO course, but this time true, the best foot course ever, when the discussion group includes the Whiteman and Hardy Weber. Dr. Hansen, you showed us new ways and got us ready for our future, but you never told us to go forth and do exactly what you do. When I visited another colleague in the area as a fellow, I asked why he did his cut that way or used that certain suture. His only logic and reply was that he did it that way because that's the way Roger did it. Later, when the Whiteman and I were sitting together, as we often do, and I had finally finished putting your talks together in PowerPoint, I began to put my talks together. As I worked, you looked at my slides. Finally, you leaned over and asked me what I was doing there, as you had not seen that technique that I was showing. I was suddenly very afraid. What? Had the Whiteman overseen something that he didn't approve of? I told you that I took the technique you had taught me, added something that I had seen from Hans and Bruce, and come up with something that worked well for me. You started to smile and told me it looked good. You seemed pleased that I had learned from you, but synthesized different ways to do the job. I believe that that is the most important principle you teach us and send us away with. I've been all over the world with the Whiteman. It is a known fact that he is the most famous orthopedist in the world. Certainly the most famous foot and ankle surgeon. Why, once when we were in Rome, he excused himself as he had to answer nature's call. Well, he was gone an awfully long time, and we figured he was doing a bit of exploring. Finally, one of the guys in our group pointed up at the balcony. Hey, isn't that Hansen up there? Yes, one of the others said, but who's that guy in the white robes? Now, I don't know if you know this, but our great leader is somewhat technologically challenged. Someone had given him an IBM Tower years before John Early and I arrived. He asked us to see if we could do something with it. We politely told him that the tower would make a nice doorstop or wine rack, but as a computer, its useful days were past. We started slowly. We got him a digital camera, which he seemed to enjoy using. Imagine my surprise after working on the Whiteman for years that I was able to convince him to get a laptop. Do you remember that first laptop? How we showed you how to reboot it, you held it up and shook it? How many years have we sat together at meetings while me taking your handwritten notes and making PowerPoint slides, then adding pictures? Once we got to a critical mass, you could then drag and drop. I got to tell you, the fact that you are keeping up with technology is pretty admirable and amazing to me, but not surprising. What does it mean when an older guy buys a new technology? It shows continued curiosity and a youthful, open brain. Now, it is true that you've had some degree of success in your career without computer programming skills. What is the quaint term you use? Oh yes, clinical observation. Well, here is something that will allow you to become a geek. Look, no mouse, no keyboard. The device is custom made for you. The input device is permanently attached to you. So, slip this into your briefcase and we can play with it later. And it's queued up to your house. STH got to the point where, as he says, he can and does feel free to say anything he wants. Thank goodness we came along at the point when he had made that transition. The complete lack of concern about what other people think about you and what you are doing is very liberating. What do you think? 15 blade right here, equinus contracture? And why do all the Greek people have these Morton feet here? Maybe a GT and metatarsal shortening is needed. It is said if you want a friend, get a dog, or two. So here's to the many dogs in your future. And we don't have to talk about the time I was walking tailless along the bluff and he ran away. This story shall the good man teach his son. From this day to the ending of the world, but we in it shall be remembered. We few, we happy few, we band of brothers. For he today that sheds Hansen's patient's blood with me shall be my brother, and gentlemen now abed shall think themselves accursed they were not here, and hold their manhoods cheap whilst any speaks that did surgery with us upon St. Sigvard's day. And so our mentor, our teacher, our master, look around the room at what you have done. All this springs forth from you, and when you ever have need of anything, our response is simple.
What is thy bidding, my master?
In closing, let me ask you to behold the white man, our deity, the man who did all in the face of unbelievable professional adversity, the man who taught us to be surgeons, the man who showed us the right way to do things, the man who is mentor to all of us, the man who has touched all our lives deeply, the man to whom I am so eternally grateful. Thank you. Dr. Hansen, sir, if we could have you up front. Eric, do you have the...
No, I gotta go up here.
Well, there's another plaque here for you, and on it you'll notice a lot of names, over 200, with each of the foot fellows, trauma fellows, and spine fellows over the years. And we hope you know how much we all appreciate everything you've done for us.
I don't know what to say to all that. Chip just told me this is as good as it gets. And I hope it only happens once. I can tell you that I appreciate all of you tremendously. I'm basically kind of lazy, and so what I've done is find people that are smarter than me over the years and point them in a direction where they will help make me look good. And you guys have done a fantastic job of that, and I'm very proud of you all, and I thank you for this wonderful tribute. Although I could have gone long without it.
So this is sort of the family tree here.
Yeah.
See, there basically
Wow.
all the aces that have served with you are listed. And it says Sigvard T. Hansen, Jr., M.D., for having dared to change the rules of the game for your legions of thankful patients and colleagues. And I'm proud to show up on 2 of your family trees. So, I'd like to